For the first time at Nairi Medical Center, a surgery was performed to implant a vagus nerve stimulator, VNS, which can be used to treat epilepsy by reducing the frequency of seizures. In the operating room, Armenian specialists were assisted by a neurosurgeon from Shanghai. They implanted a special device in the patient's neck, which sends signals through the vagus nerve to those areas of the brain whose increased activity causes epileptic seizures. This is a minimally invasive and painless procedure.
VNS, or vagus nerve stimulation, is a small microcomputer that is implanted on the vagus nerve in the neck. No craniotomy is performed, meaning there is no intervention in the brain itself, and this is a great advantage. In the case of epilepsy, surgery using VNS is considered the first-choice operation.
This is a metallic electrode for vagus nerve stimulation, which is wrapped around the nerve itself, then connected to the device and implanted under the skin. This is the device for clinical programming, which remains with the doctor. And this is the patient's device, used to activate the stimulator, but the adjustment of parameters is controlled only by the doctor. It is the doctor who performs the main management.
The specialist notes that compared to European and American analogs, the advantage of this device is its affordable price. Moreover, the patient does not need to come to the hospital each time for updates. This can be done remotely. One of the latest achievements of Rashina is also the closed-loop deep brain stimulation (DBS) system, which was also applied for the first time at Nairi Medical Center during the visit of Chinese specialists. It significantly reduces the manifestations of motor disorders in Parkinson's disease and prevents its progression. Unlike many other manufacturers, the Rashina Deep Brain Stimulator operates in a closed-loop mode based on artificial intelligence. The system independently determines how much to stimulate the patient's brain.
If a patient has a closed-loop deep brain stimulator, it automatically detects abnormal signals and increases stimulation without the doctor's intervention.
The most important advantage for the patient is the price of the device, which is significantly lower than that of European and American analogs. At the same time, in terms of quality, they are in no way inferior, something that Arman Hakobian confirmed after visiting China a month ago, seeing the production with his own eyes and observing Professor Shu's work at the hospital in Shanghai. The Chinese specialists were also deeply impressed by Nairi Medical Center, which from now on will become their official partner in Armenia.
This is my first visit to Armenia and my first joint work with Armenian doctors. Although the hospital is small, it is very cozy and neat, and highly qualified specialists work here. I really like it. Dr. Arman is a neurosurgeon with extensive experience who has performed numerous functional surgeries. I am confident that these two methods will also be successfully applied in this clinic. This cooperation is very important for us because it gives us the opportunity not only to work with Armenian doctors, but also to get to know Armenia better.
The Chinese specialists are confident that after their visit to Nairi Medical Center, these new technologies will be successfully applied, especially in the treatment of patients with drug-resistant epilepsy and Parkinson's disease. Arman Hakobian noted that they will maintain constant contact with their Chinese colleagues, discuss clinical cases, and jointly determine which patients are indicated for these surgical interventions.